Thank you for your patience. Of course, now we're going to record this meeting. Anything said on the call, anything seen in the webcam, anything typed in the chat box will be recorded and preserved for the recording.
In perpetuity.
You don't need to present your screen. We'll monitor the chat box for questions. You could identify yourself before stating your remarks. That's helpful for everybody. If you're on the phone only, you may need to hit *6 to unmute yourself. Thank you for your participation and patience. And Dale,
Shelley, do we have quorum?
We have, I can see on here, Nikki, Chris, Dr. Seidler, Jordana, Dr. Woolridge, and Stafford, and a couple of numbers.
Hey, Shelley, Jackie Evans is here. I'm just on the phone, and my number is the 520-820-0897.
thank you. Did you say Don Darwin was on?
Who has the 520 number with a 97 at the end? Was that you, Jackie?
Yes, it is.
Okay. There's also a 928 phone number on the line.
I have Dale, Jordana, Nikki, Jackie Evans, Chris Ramos, and Josh Seidler. 1, 2, 3, 6. We're one shy. Tony, or no. RJ
said he cannot come.
Did we hear back from Don Darwin?
He cannot.
Is Heather Miller on the call? Is Tony on?
He said he will be able to, hopefully we'll be able to call in from the road.
And Stafford?
Yes.
Okay, go ahead.
Yes, Evan? Okay. Perfect. All right, Dr. Ward, I think we can proceed.
Okay. Shelley, your mic is really quiet. I don't know if that's just on my side or if other people aren't hearing you well. So forgive me if I ask you to repeat yourself.
All right, I'll try
Okay.
to get closer to the microphone here.
And the display of the agenda is a little bit small as far as font and reading is concerned. I don't know if it would help other people. I actually have a hard copy in front of me, so, but, beautiful. Thank you.
Thanks for the suggestion.
Okay, so do we need to do, you just went through the attendance list. Do we need to do a further roll call? Do we want people to holler out if they're on the phone?
Yeah, we'll go ahead and start at the top with the call to order.
Okay. All right, well, I move to call the meeting to order.
All right, I'll do the roll call. John Darling. Dale Woolridge.
Here.
RJ Dieters. Jordana Carpenter.
I'm here.
Thank you. Tony Corazzini. Nikki Kovac.
Fair enough. Here.
Heather Miller.
Heather Miller's here.
Oh, hi, Heather.
Thank you.
Jacqueline Evans.
I'm here.
Thank you. Tony Huma.
I'm here, and just to let you know, I'm on the road, so I may be going in and out.
Okay, thank you. Ann Stafford.
Here.
Chris Ramos.
Not sure if my mic is working, but here.
All right. Debbie Johnston. And Joshua Zeidler.
I'm here.
Count 9, we have quorum.
Wonderful. Well, thank you. And
It's making good to get on.
so next item on the agenda is to do our attendance report. And Shelley, I don't know if you have that file to be able to show people.
I have that right. Hold up.
Great, thank you. So as you know, regular members, we do track your attendance. And so I wanted to give you all a friendly reminder that if you miss 2 consecutive meetings, the Bureau will contact you to ask if you're still interested in serving on the committee. We have no new member vacancies at this time, so we work for quorum. And we hate to lose anybody, but if you find that the timing of the meeting or your opportunity to remain participate is limited, to let us know, and then we find the most optimal replacement. Hopefully that won't ever happen, and we'll have a solid group going forward. I do want to welcome our new member, Joshua Ziegler. Joshua, I saw you on the call. And as a quick accolades, Josh is going to be filling our emergency physician position. I snuck a peek at your CV and very impressed, and we really appreciate having you involved with the group. Josh has been an emergency physician in the Phoenix area for over 20 years. Well, primarily, I think I saw Chandler area, but has also had over 15 years involvement with pediatric urgent cares. Joshua, do you want to give further introductions?
Sure. So thank you very much for having me on the committee. Yeah, I'm a full-time emergency physician down at Chandler Regional in Mercy Gilbert. I'm also the EMS medical director for those dignity health facilities. So I oversee multiple EMS agencies, along with the medical director for some paramedic programs and EMT programs. Board certified both in emergency medicine and general pediatrics, and then subspecialty in EMS. So once again, happy to be here.
Great. Great to have you. Thanks so much for joining us. And that at present, Julia, correct me if I'm wrong, but our formal or regular positions on the committee are full now. So
Yes, that's
great.
correct.
And as showed on the screen is our 2022 schedule for the upcoming meetings. That was included in your meeting packet. So if you wouldn't mind, go ahead and dialing your calendar in on those dates so that you have them in mind as we go forward. Because those dates are, those quarterly meetings are all set now. Okay. Without further ado, I'm going to hand the mic over to Julia for the Bureau reports.
And I am going to hand it over to Rachel Garcia, our Bureau Chief.
All right. Good afternoon, Dr. Woolridge and council members. I just wanted to give a brief update on the Bureau funding and staffing. The state budget's been approved. The Bureau's budget for this year has been approved for a slight increase, but actual funding is expected to remain relatively level this year compared to recent years. Regional funding appropriations and contracts have been confirmed and sent out, including level funding from past years, in addition to an additional $5,000 per region in EMS for Children grant funds. Those grant funds are intended to be used for specific tasks and deliverables. And we can touch on those if there are any specific questions. I'll also mention the Bureau has several vacancies posted on the state jobs website. In the last month, we've welcomed a new hire, Travis Connors, as project coordinator within the Bureau. He joins us today, and I believe will also give a brief introduction. Other than that, I think Julia may have an announcement about an additional new hire that will be joining us soon, and so I will pass it back to you, Julia.
Yeah, so I do have exciting news that we have identified a candidate to serve as our EMS for Children coordinator. I think he will do a great job in the role. So he can't start, unfortunately, until September, so we have a little bit of time before he joins us, but I think he'll be a great addition, and I look forward to introducing him to you all. And then I'll also just add, lastly, that we did apply for some additional EMS for Children funding to help support our Arizona's Pediatric Prepared Emergency Care Program, as well as pediatric emergency care coordinators across the state. So we'll hear about that in September, and I'll keep you all updated on whether or not we are recipients of that. So that's all for the Bureau update. I think that we wanted Travis Connors to introduce himself. If you're on the line, Travis.
Hi, can everyone hear me?
Yes.
Okay, hello, my name is Travis Connors. I am the new project coordinator focusing on public health initiatives for the Bureau of EMS and Trauma. A little bit of background about myself. I got my MPH from the University of Arizona, and I actually came from the medical marijuana program with the Arizona Department of Health Services as the program manager. If you have any questions about my role or what I'll be doing, please let me know, and I'll be glad to answer those questions for you. Nice meeting you all.
Looking forward to working with you, Travis.
You as well.
Yeah. Thanks, Travis. Dale, I'll just continue down if that's okay with you. So next on the agenda, National EMS Data Analysis Resource Center NADARC survey results. Sorry, that was a mouthful. I just wanted to share with you the results of the survey that we conducted earlier this year among EMS agencies. So I will share my screen really quickly, just so that you can get a little snapshot. I will be formulating this into a report and posting it on our website, so I can send that out to you as well. But I'm sure if I can make this bigger. Yeah. Okay. So, so this is the 2021 EMS agency survey. It happened January through March of this year. Of course, still during COVID times. So I think our response rate was a little lower than I would have hoped. As last year we did have about 100 responses. So this year, 75 agencies were included. And this is just a snapshot of where we stand in two of the EMS for Children performance measures, which is the Pediatric Emergency Care Coordinator. So this is saying that approximately 33.8% of agencies do have that in place. And then use of pediatric specific equipment, approximately 29.7% of agencies, at least that's the survey, fulfill the EMS for Children performance measure requirement. I can just kind of show you all of these tabs. So this is the map of respondents. So we just get pretty good representation, I think, from across the state, perhaps missing some of the northern area. But I think this is a great spread for what we did receive, the responses that we did receive. This shows that we have been increasing over time for the most part. A little bit of a decrease here, I think. For the pediatric emergency care coordinator percentage, but it's not a huge decrease. Let's see. So if anybody have any questions, I'm just going to go through it pretty fast. But of course, I will, again, summarize it into a report and post it on the website. This is the next performance measure. So this was pediatric, use of pediatric specific equipment. So it does show an increase there, which is of those that met their requirements. So this is a breakdown of the pediatric emergency care coordinator piece. So you can see how many agencies say that they have a pediatric emergency care coordinator versus plans to add one, interested, or none at the moment. Yeah, does anybody have any questions or anything that they want to see more in depth at this moment? Okay, well, if you have any questions about that at a later time, I would be happy to share more information about that with you. And I will send out the information to everybody once I have it formulated in a document format. But for now, I will just move on to the National Pediatric Readiness Assessment. So that's another survey that's going on this year, but this is among hospitals so far we have 26 responding hospitals, which is great, but I'm really hoping that we are able to get to a higher response rate. We're pretty low as it stands across the state, with the nation's response rates right now. So they did just extend that to August 31st. So we have a little bit of extra time, but if you work in a hospital or know any contacts in any emergency departments, I would encourage you just to mention it and see if they've participated in that. That's all I have, Dr. Ward. Back to you.
Okay, great. Thank you.
Sorry, but do you want to share your screen?
Yeah, well, not just yet. I mean, as we get
Okay.
farther along, I think it might help the discussion as to we get into some of our agenda items. But I think next on our agenda is to get the committee update from Chris Ramos. Chris, I saw you on the call. Thank you for attending. We had a pretty, I think, good discussion during the education committee. So I was hopeful you'd be able to give us an update on that.
Hey Dale, I was in and out with service on my phone, but what I heard, the tracheostomy draft was approved with a couple of exceptions, more abbreviation things, and then we discussed furthering education into respiratory and potentially seizures. And I think there was one other.
Right. Yeah. Well, and I think the primer is that it kind of dovetails with maybe some educational opportunities going forward. And I guess it was a read my mind comment there was the part that I was enamored of is that brought up in the education meeting was this issue of how we can better facilitate pediatric-based training through the Bureau and to EMS personnel throughout the state. And if that can be facilitated through whether it be sponsored sites, live events, online events. Both Chris and I had made comment about what topics I think would be very helpful for people out there and how they could be run through. And then Chris, you had mentioned your work that you're already doing in the realm of education. So, but I think we can, no other further comments on that. I think we can step forward and talk about that a little bit later in the agenda meeting. So any other questions or comments about the tracheostomy training that we just got approved?
I think we still need to approve them in this meeting as well.
Oh, you're talking about the questions.
Yeah, sorry.
Yeah. I think Chris was referring to the slide set, the education module. And then, yes, I'll step us forward to talk about the questions a little bit later in the meeting for sure. Okay. Next agenda item was to discuss, amend, and approve the draft meeting minutes from the March meeting. And can I have a motion to review those minutes?
Ms. Jordana, I'll motion.
I heard Jordana, I think. I'm sorry, repeat so I can get your name.
Jordana.
Okay, thank you. Do I have a second?
This is Dawn, I second.
All right, Dawn, I see you on the screen. Thank you. Okay, and I think Shelley can, or Julie can walk us through that on the screen. Does anyone have any edits to the meeting minutes for March 18th? If no moves to edit, I would motion for us to approve those minutes. Can I have a motion?
This is Dawn, motion to approve.
Thank you, Dawn. Second?
This is Jordana, I'll second it.
Thank you, Jordana. Okay, so draft meeting minutes from March 18th are approved. Okay. And
I got Dale.
yes, ma'am.
Ask the body for their vote. All those in favor say aye.
Yes, I'm sorry. I'm not good with the parliamentary work. Okay, let's go ahead and vote. Everybody who wants to approve, say aye.
They are beautiful minutes.
Aye.
Okay. Anyone opposed to approving them would say nay. The ayes have it. The meeting minutes are approved. Thank you for keeping me on the straight. Right. So this is the portion of the tracheostomy training that Julia had alluded to. So as Chris had mentioned, the educational module, the slide sets were approved with edits in the education committee. But what we want this to do is we want this to be CE ready for agencies out there who pick it up. And again, these files and resources are available on the Bureau's website and under the educational section. But for these to be CE compatible, there needs to be a component of feedback. So we created some post-test related questions related to the tracheostomy training. And that's what you see here. What I would ask the group to do is to review these. These were in your packet, so maybe you had already looked at them. If not, we'll take a quick look at them here. And after reviewing and requesting edits, I will then make a motion to approve or not approve. So I'll let you guys read through those as you go, and Julia or Shelley can scroll us through them slowly. Any comments from the group? I would personally move to make 2 edits if I could. If you wouldn't mind scrolling back up just a little bit.
All right.
See question 8, when it's a multiple choice question and there's multiple answers, in parentheses at the end of the question it says mark all that applies, mark all that apply. I would ask that we add that comment, mark all that apply, to the other questions with multiple answers. And if you scroll up, you can see question 6 has multiple answers. So the question 6 would read, identify which of the following which of the following that a family might have in their quote go back end quote. And then I would say parentheses, mark all that apply, end parentheses. And then if you scroll up a little bit more, there's one other. Scroll down. I thought there was one other.
Oh, 9.
Oh yeah, keep going down. Yeah, there you go. Question 9. Yep. So the same here. Thank you. The question here would read, indicate the 3 different types of suctioning, and then it would be parentheses, all that apply, end parentheses, question mark. I would move for those edits.
Okay.
So for formality, I would ask a vote from the group. Do people agree with those 2 edits? Say aye.
Aye.
I agree.
Okay. And anyone opposed to those edits? Okay, so those edits would be inserted. Julia, would you be willing to take care of that?
Yes, absolutely.
Great. So following those 2 edits, does anyone else in the group have any edits to these questions?
I'll just add really fast that the one edit from the Education Committee was related to question 2, just to spell out children with special health care needs rather than using the abbreviation.
Okay. Yeah, that's smart.
And this is Dawn Bailey. I would just also add for question number 4, I think home nursing staff is an important role to rely on gathering information, especially in the absence of parents or guardians. A lot of these patients have home nursing as well. So I would hate to exclude that as a reliable source of information.
So Dawn, might I suggest we strike option C, and then there would only be 4 answer options?
I mean, where would you put home nursing staff? Would you add it to D with parents and guardians?
The intent of the question was to reflect on some of the slides in the education set that emphasized that the parents or the guardian was an ideal source for information. But I totally agree with you. I think home nursing staff is also a great resource. So maybe the wording of the questions should say which would be the best resource, or we can strike the question altogether. But Dawn, no, you have a legitimate concern. I agree with you. That's a faulty question.
Yeah, I'd hate to strike it because I think it's a good reminder for the EMTs when arriving that it's okay to utilize them as a resource for information. I just would hate if there's only one answer that it seems like the home nursing staff is being excluded from that resource. They may be there without
This
the
is
so.
This is Sandy. Why don't you do it like you made the other questions? Name 2 reliable sources for gathering information, and then mark the 2 that apply. And then that way that's all you'd have to do. You could have the home nursing staff and the parents and guardians.
Comments from the group?
This is
Great
Jordana.
suggestion, Sandy.
Say again.
I think that's a great suggestion.
Without Julia being able to edit live in front of us because it's a PDF, maybe we can verbally state what the question would say so Julia can get that on paper and make sure it's formalized. So name 2 sources of information to gather or to gather information for the child. How would you word that, please?
Name the 2 most reliable sources for gathering information for the child, on gathering information for the child.
Okay. Name the 2 most valuable sources. Julia, do you have that?
Reliable or valuable? Reliable. Name the 2 most reliable sources for gathering information on the child.
Yes.
Good. Good. Okay, just because, and forgive me, but just because we don't have the visual on that edit, is everybody very clear on the edit so we can formalize the vote? Okay, without any dissent, I move we make that change. Julia, would you mind reading that change again one more time for us?
And I'll put it in the chat box as well. Name the 2 most reliable sources for gathering information on the child.
Okay.
And then I will include home nursing staff as one of the correct sources.
Okay. And then in the document, options C and D will be highlighted.
Yes.
Mark all of the
Okay.
Yes.
So I would like to make a motion to the group to approve that edit. For those in agreement, say aye.
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 I'm like,
Aye.
Okay. Anyone opposed to that edit? Okay. So the edit stands. Now I'll ask for a vote. I think, excuse me, are there any other edits that people would suggest for this question set and post-test question set? Okay, without any further edits, I would move to approve the question set with the 3 edits that are now in place. Everybody who recommends to agrees to approve, say aye.
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 Anyone opposed? Okay, great. The ayes have it, and we've approved our question set. And these will be posted on the Bureau website as a resource for individuals looking for CE, individual agencies looking for CE. So congratulations to the committee. We have another educational tool in our toolbox. So thank you all. Okay. The next discussion item B, discuss approve of, item C, discuss approve the development of naloxone for pediatric patients work group. This was proposed prior to the meeting as an opportunity this committee would have going forward. And again, that's item 6C. And that would be to work on augmenting the current education that's in place about treating pediatric patients with Narcan in the field. Okay. And I don't know if I could share my screen, or if Julia or Shelley, you have some of those supporting materials that we had.
For the naloxone piece?
Yeah.
Oh, do you want to see the current naloxone training?
Yeah, I wanted to show some people some of the slides.
Oh. Let's make a motion to discuss first.
Oh, okay. So let me give a little more background, and I apologize for that. So item C here, it was brought up to the group that anecdotally, at least, children who were altered in the field and may have been candidates for receiving Narcan did not, and that there may be a reluctance by pre-hospital personnel, whether they be first responders of law enforcement or EMS, there may be a reluctance to administer Narcan in children based on maybe a misunderstanding in that, is there not enough education related to it, or are they just not aware of the dosing strategies for children? So the proposal is could this committee look at that educational material and add content or create a new educational module that would maybe fill that gap and assist our first responders in the state of Arizona when it comes to Narcan in kids. Hope that clarified it. Comments from the group is personal exposures to this kind of a scenario. What does the group think?
This is Dawn, darling. I 100% support maybe getting more information out there. I don't even know if it's education besides just dosing, but I do see a lack of giving it in the field. Chris Ramos could probably chime in a little bit better because he does more with EMS at our hospital. But I think I mentioned it last time. This would be valuable to do a little outreach on.
I would second it. I would second that. I don't have the data on it, but I can tell you that at PCH, like, exposure to fentanyl and opiates are on the rise.
Okay. Thank you all for that. Any other comments? So in doing a little bit of work beforehand in preparing for this, I did look at some of the resources that we do have. The Bureau does have, and Julie, I don't know if it'd be worth pulling up some of those links. Oh, you got it, perfect. So this is the educational module, thank you, that's currently out there. And what I would propose is that we as a group familiarize ourselves with this. Similarly, there's standing order documents that are currently on the Bureau's website in regards to the dosing increments in pediatric patients. So if you scroll through this, it's a behemoth. It's 85 slides. Gives a lot of epidemiologic background, a lot of rationale to the benefit of Narcan. How it's supplied, whether it be auto injectors versus paramedics giving incremental dosing. Who can get it? Here's slide 51. Perfect. You got it. So this is the only slide in the entire 85 slides that mentions kids. Kids and pregnant, safe in kids, use your Narcan. Safe in pregnant women, use your Narcan. This was the only slide. So the question to the group is whether or not, one, does the group want to take this task going forward as to creating either another module or suggesting adjustments to the current module in how we can improve this so that Narcan is better utilized in the field for our pediatric patients.
Dale, sorry to interrupt quickly. Just from a housekeeping perspective, a little bit of background. This curriculum per statute has to be created with AZ Post. So we just may not have the flexibility to just go adjusting this or making recommendations for changes to this one. This is a little outside of just the Bureau of EMS. The action item that we have is simply the development of a work group. So the work group's goal would then be to figure out what next step to take in terms of options. But the action item that we have on the agenda that we can take action on today for public meeting laws is simply, do we form a work group?
Okay. No, please clarify, because in looking into this, I saw two separate educational modules. One was for law enforcement and one was for EMS. Are they just redundant on each other, or are they truly tailored to the individual field operator?
I'm not sure where you found the specific one from, so.
Yeah, the one that I'm showing is the law enforcement one. Is that
Okay.
this is the one that you reviewed?
I actually looked through them both. Yeah,
Oh,
there's a lot of commonality to both of them. I guess my question is do we have more freedom, more autonomy if we're just modifying the EMS one? Or should our work group go forward as to offering advice towards both?
If I'm not mistaken, law enforcement only uses nasal naloxone, whereas EMS can use other forms.
Law enforcement can also use intramuscular as well, Sandy. So, but again, sorry, not to hammer the point home, we just have to really stick to the agenda items for public meeting rules. So we just have to simply vote today on a work group, and the work group could then have more time to discuss which potential ones to make adjustments or changes to. So that's just from a cleanliness standpoint, just have to stick to that today.
Okay. Received loud and clear. Gotcha. Side question to the group is, I'm an AZ Post instructor. Is anyone else in our group an AZ Post instructor?
I am as well. I know Dr. Gaither and Dr. Rice are. So several EMS physicians in Arizona are specific for naloxone related activities.
Okay, all right. So we do have some overlap in that regard. Okay, great. So if I'm understanding our directive going forward, I'm going to ask for a motion to create the work group. And Julia can offline assemble that list of people by your reaching to her and expressing your interest. Does that work, Julia?
Yes, that's perfect. If anyone wants to volunteer now as well, I can put your name down.
Okay. All right, so I make a motion to establish a work group to explore how this educational module might be improved to include by including pediatric content. There it's stated. I have the motion out there. Those two agree? Say aye.
We'll just take a second to agree to bring your motion to a vote.
This is Dawn. I give it a second, and I'd like to contribute to the work.
Thank you, Dawn.
This is Jordana. I would like to contribute as well if I can.
And now we can take it to a vote.
Okay. Okay, so we'll take it to a vote, and we're voting to approve to create the work group.
Yes.
Okay. All right, those in favor say aye.
Aye. Aye.
Aye.
All right, and anyone opposed to the creation of this work group? Okay, so the ayes have it. We will assemble a work group to start working on this topic again on the agenda 6, item C. And anybody else want to shout out to be on the list? Or if not, you can email Julia separately. You can put your name in the chat too. That would be fine.
Dr. Ward, Heather Miller would like to participate too, if possible.
Great. Thank you, Heather. Okay, I'm going to step us to our next agenda item, and that's agenda item D, to discuss and or approve the development of a work group to address pediatric behavioral health. Admittedly, this is a very broad topic, although it's very impactful as far as the approach that EMS responders take when it comes to behavioral health care needs during their scene calls. The work group, I think, would not only, because it's a broad topic, would focus primarily on where we can be impactful, whether this be an educational module and or maybe an algorithmic outline of how to approach this type of individual when on call. I think I'll make this one briefer. We'll follow the same scenario. I would make a motion that we assemble a work group. Can I have someone who would first that motion?
This is Chris. I can motion it.
Okay, thank you. Do I have a second?
This is Ann. I second.
Thank you, Ann. So with that approved, to bring the vote of establishing a behavioral health work group and establish that in the same manner that we are establishing the Narcan work group. If I can have a vote, and the entire group, and I'm sorry, I'm just not getting my words today, the entire group to vote on if we can approve the establishment of a behavioral health work group. If you approve, say aye.
Aye.
Okay.
Aye.
Aye.
Great. Is anyone opposed? Okay, so the ayes have it. We have another work group established. Again, reach to Julia, and then you can put your name down on the list if you're interested in participating in that. Thank you to the group. Okay, any further discussion in that regard? Okay, I'm moving us to option to item number E. Discuss the current requirements for pediatric certification hours for paramedics and EMT certification. So a little bit of background on this. So EMT and paramedic certification requires regular CE following certification, and that's ongoing CE, continued education. Looking at some of the rules and some of the requirements, Arizona is on par with National Registry in that it does require 5 hours of pediatric education. And that's a total of, I think, and if anyone knows or correct me, I think it's a total of 24 hours required. 5 of those have to be pediatric related CE. And then again, that's maintaining of certification for EMTs. The question to the group here ultimately is whether that's ideal as far as some of the requirements for certification is concerned, and or should that be readdressed? My personal opinion when it comes to education is that you ideally would want to educate individuals on things that they see less frequently, because you're not able to establish the motor memory because you see it less frequently. So in that pediatric transportations aren't as common, it would behoove someone to have more regular education in that regard. The adult related events are done more frequently on a day-to-day basis in the field and may not necessarily need it as much as I think the pediatric cases do. So is there a benefit to expanding and or recommending an advancement to that training requirement? The 5 is a minimum. It doesn't mean that an individual EMT cannot exceed those 5 hours, but the 5 is a minimum requirement. Is that ideal? And I'm asking an opinion from the group. Is 5 enough? And I would really welcome the paramedics on the call to weigh in if they feel that the 5 hours is sufficient.
This is Sandy. Is this something that we can do similar to National Registry? I know it potentially could be a nightmare having to change it on a regular basis, but to require specific topics for recertification, you know, such as the ones we discussed in education. This is very broad. It's just pediatric, it's just hours. So it could be anything. And they may not be touching the things that we feel are important.
Yeah. Yeah, I don't think we have the authority to necessarily alter the statute in the rule book, but to advise that those numbers be reconsidered. I think that would be in our purview to advise.
Yes, this is Gail. I think Dale described that very well. Really, the role of this committee is to advise the Bureau on kind of recommendations. So even though that rule writing is not open currently, recommendations such as this from this committee could be taken forward when that rule becomes open. So certainly that is the purview of this committee, is to make recommendations to the Bureau. And we do welcome that, as you guys are really the subject matter experts when it comes to pediatrics.
Mm-hmm. Yeah. Thank you, Dr. Bradley. You know, the other thing I consider, you know, it's the carrot or stick approach. You know, 5 hours is a minimum, but it doesn't mean that an EMT cannot reach beyond those 5 hours to get more 5 hours training. And a lot of CE that is obtained is based upon availability. You know, one of the things that I think we've been working on very positively in the last year is developing educational modules and having them be available. An alternative strategy is to make pediatric CE much more available to our pre-hospital personnel. And if being more available, that would encourage, I think, or incentivize, indirectly at least, our EMTs across the state to do more educational training in pediatrics. So I think tackling it in both ways. One, does the rule book ultimately need to be modified? And two, and I'm actually skipping a little bit ahead to our next agenda item. Two, what are the additional educational modules that this committee could be putting together and putting out there that would be helpful for our first responders across the state? Dr. Bradley, was it your thought to establish a work group and to discuss this further? We can share the rule book with our entire committee members, shelf this and bring it back for discussion, or we can assemble a work group to be able to maybe discuss this further between the quarterly meetings. What was your thought?
I think this is really just trying to establish the conversation to get the group start thinking about that. Really just kind of broadly thinking how we can help improve outcomes for pediatric patients in the EMS and pre-hospital setting, which, as you lined up very nicely, does kind of lean into the next item, which is item F. One of the things that's being brought forward as a potential gap is trauma triage in the nonverbal age child as something where, if funding were to become available, would that be something that the state could help or facilitate with another stakeholder, providing education that could be used across the state? And I think the more we create these educational curriculums that are hard to find and really high yield and specific to EMS, I think we just elevate the level of care pediatric patients get. So I think it's really just trying to get that conversation started. And certainly if the group wanted to, we could add that as an agenda item to do something more formal at the next meeting, but we wanted to just really get that conversation started today.
Yeah. Thank you for that. And that, that's the ultimate question. When I had first learned that 5 years was, or 5 hours, 5 out of the 24 hours was our requirement, it was a little bit of a surprise to me, and would encourage, in general, any EMS individual, any pre-hospital individual to do more training in pediatrics. But I think I'm just preaching to the choir for everybody who's at the committee meeting here today. So maybe, Julia, maybe you can share the link to the rule book for everybody, and then we can kind of pose that question and have this discussion topic kind of roll into the next as we approach that. And with that being said, I am going to step us to our next agenda item, agenda item number F, and that was to discuss considerations for additional training gaps, including development of pediatric trauma triage assessment training. As mentioned before, in the last year, PACES has worked towards creating educational modules. But I think the point of this agenda item is to really focus on what are the existing gaps and what modules can we be working on going forward to make those available to our pre-hospital personnel across the state, and clearly making them be a CE compatible module, so those can be a resource for the individual agencies. Dr. Bradley had mentioned triage assessment training, particularly for the pre-verbal child, dealing with the pre-verbal child in the trauma environment. It can be very nuanced, and it does take a different approach. And I think that would be an educational feature that I think would be very valuable. Chris, if you're still on the phone during the Education Committee, you had a suggestion too?
Yeah, I mean, if you look at NEMSIS data, pediatric seizures are some of the top reasons EMS is activated. And then at our hospital, we keep data, and there was a study published a couple years ago where it showed like the first average ASD dose was like 28 minutes, and then 63% of kids that have status epilepticus onset in the field don't receive any medication at all. So I think in general, seizure recognition and treatment is there's still an issue. So any education on that would be good. And then just making the Rampart trial more public. For some reasons, some people don't necessarily know about that either, although it's reflected in protocol.
Yeah, and you used an acronym AST, anti-seizure treatment, correct?
Yeah, ASD, yeah.
Oh, yeah, ASD, yeah. And anti-seizure drugs. Thank you.
Yes, sir.
Yeah, great. So as far as other gaps are concerned, one comment that we had during the Education Committee was respiratory emergencies. The most common cause of cardiovascular collapse in children is related to respiratory distress and respiratory failure. So that might be another gap item that would be helpful to be able to put out there as far as an educational module is concerned. And I think the next question, if I can extend that further, is there other modalities of education that this committee should start reaching towards? We've created a couple modules. They're going to be available on the website. But is there some live related modules, or can we partner with our EMS regions, pediatric educational events that are going on, the Arizona chapter of the American Academy of Pediatrics, and not to prod you on that one, but are there partners that we could start working with to be able to kind of share this effort, to be able to further education and fill some of those gaps?
Yeah, at the Arizona chapter, we are getting ready to launch a new learning management system, so that we have all the education in one place. And one of the things that we're hoping to do is have it sectioned out so pediatric emergency medicine will have its own section. So we'd be happy to partner in getting the trainings up there.
Thank you.
Can you say the name of that system one more time? And
What was that, Julia?
sorry, could you say the name of the system that you're about to launch one more time?
It's a learning management system, an LMS.
Oh, okay.
Yeah.
Great. Other comments from the group? Rather than this being an item that rolls over to the next meeting, I'm wondering if I could push my luck and see if the group here would consider working and setting up a work group to start on one of these modules now. Chris, go ahead.
Sorry, I don't think we can, unfortunately, because of the open meeting law. It doesn't, because because we don't have specifically written to discuss, approve the development of a work group. We aren't able to do that, unfortunately.
Okay. So and keep me online here. Can we create a work group to discuss our training gaps? So for our next meeting, we have those itemized gaps to be able to move forward on.
No, I would say that we can prepare like individually if we all wanted to see if we could identify some gaps and then bring it to the next meeting to share with everyone else. That would be appropriate, but we can't meet for that purpose without having it as an agenda item to develop a work group.
Okay, so if I'm understanding correctly, a non-voting issue would be for me to suggest to the group to, as homework, people walk away and with kind of that homework task of identifying what future gaps might be that we could work on going forward.
Yes, that would be fine.
And then if you identify those and are brainstorming, maybe let us know in advance of the next meeting so we can formally have it on the agenda so that it can be in a voting item. Is that appropriate?
Yes, anyone is always able to send in requested agenda items prior to the agenda being posted. So if you think of something that you would like to address, then feel free to send that to us and we can get that on the agenda.
Okay. Okay, great. All right, so that is homework going forward. So I would ask everybody to just kind of brainstorm some of these educational gaps, training gaps that we could be working on going forward. And I would appreciate that from everybody. Stepping down to item number G, discuss a timeline for the 2021 Pediatric EMS Annual Report and special considerations for trend analysis when reviewing the 2020 data. So some of you may or may not be familiar with the annual report that's put out. Julia, do you have that available to maybe show?
Yes, I'm about to display it.
All right. So Department of Health puts this annual report out, and it's essentially a report of the incidents, EMS incidents throughout the year. And the purpose and the methods are all stated here. And then you can see a little bit, the next page is kind of a summary of some of their conclusions or the things that they identified. One of the thoughts or questions is there a reporting element that's not included in the annual report that we would advise or encourage to be reported going forward? And that could be trends that have increased in frequency in the last couple of years. COVID's tapering, but still relevant to the annual reports going forward, at least throughout the 2020 year. But if we can take a kind of a brief look at that. And the report's, I think, pretty thorough. Reports incidents by age, by gender, by county, as you can see here in the index. So what I would ask the meeting members to do is to, on your own time, forgive if this sounds like more homework, but on your own time, maybe familiarize yourself with this. Identifying the features of the report, and are there any elements that we would find helpful as far as whether it be injury prevention or preparedness, or again, educational or training gaps. Josh, yes. Julie, I don't know if you see the chat that Josh is asking for a link to the report. Yes, we will definitely send the link to the report to everybody, for sure. And I guess I'll put this into that same category as homework going forward, where we can look at this and see if we can identify some features in which we could request that additional components be reported on.
Thank you, Dale. I think this report is relatively new for the Bureau. So when I first came on, I think that was when we first started working on the initial pediatric annual report. And so I kind of guided this towards what I thought people would find interesting, but certainly open to any input from this group. So if you have any input or review, you can email Julia, myself, or Shelley. We'll make sure it gets to the right team within DQA. One of the suggestions that came up in the last meeting was to really kind of overlay any COVID-related trends. So when we saw the surge in COVID in 2020, to kind of overlay the trend as we look at any annual trends across this year. So we will be adding that in. But please, like I said, this is a new report for the Bureau. So if there are items you'd like to see added or changed, please let us know.
Great, thank you, Gail. So with that being said, and again, we'll send you the link to this. Thank you, Julia. Are there any other agenda items from the group to be considered for the next meeting? If you know some now, please shout out. Similarly, prior to the assembly of the next agenda, we can have them added on if you consider one down the road. Anyone have any agenda items in mind? Okay. Okay, so stepping down our agenda, we now have call to the public. Anybody who will go ahead?
Yeah, I think it's Ray that has a hand raised.
I don't see the full.
Yeah, sorry, Dr. Woolridge. This is Ray Proa, EMS officer for my fire, also on the TEPI committee. I didn't know if I was able to speak. I thought I had to raise my hand for general public, so I apologize. I didn't want to interrupt. I thought this was just the board portion, but for call to public, I just wanted to say, because I was pretty excited to see on the agenda, like we were just discussing, was sections E and F, and I am close friends with EMSC Brett Cross from Utah. So seeing all of this and seeing a lot of what everyone's talking about seems kind of the same issue. I really enjoy seeing the PACES committee putting out education for the rest of the state. Since, like I said, I totally agree with you. 5 hours seems a little low in my opinion. That's just me. I can say we probably easily double or triple that. And I've also seen Julia Vinton a couple times and in full disclosure, I also teach part-time with Hantevi Pediatric Solutions. But what, just kind of to get the training, because I think we can all agree one of the worst things other than doing nothing is being reactive. And one thing that Brett Cross has taken and done with Hantevi is he is pretty much replaced Hantevi as the PALS in the state of Utah, to where EMSC has full control of it. They can do instructors for it, and they basically have all these modules. We're talking 250 plus hours on their website of education that you can put into an LMS system, like I believe Ann was talking about earlier, which is a learning management system. So one of the things I've, being on the TEPI committee, I've kind of understood is we're so spread out in the state that the central region has different challenges that I have over here in the way west rural area. Being knowing that my level 1 trauma is 40 plus minutes away by flights, 2 hours by ground, things like that. So maybe I am weak in trauma, maybe I'm weak in triage, maybe I'm weak in medication administration, to kind of touch on what someone was saying about seizures. But maybe they're weak in something. I can take those modules of those trainings that are already provided. We can set them up as the PACES committee sees fit to meet the Arizona guidelines, and then throw them out and get that done very quickly. And that's something that they've done to where their class and course is 8 hours and is totally certified through the state. So I'm just kind of throwing that out there as an option, since it seems like a lot of departments have gone to Hantevi, since it just seems to be always pushing, always on the cutting edge, always on to give the best patient care possible. And the beautiful thing about it is it doesn't just pertain to peds, but it also carries over to adults. A lot of the teachings, a lot of the education. So that was just something I wanted to kind of put out there as call the public as maybe an option to be able to give the training to the state on a faster scale, and without having to kind of be redundant and do all the work and get it out a lot quicker. So I just wanted to put that out there. Like I said, I didn't mean to step on anyone's toes or throw anything else out there. I was just throwing out options that I was really impressed with Brett Cross, and I saw how Utah did, and I kind of didn't see any reason why we couldn't do that as a whole either.
Yeah, that's great. I'll have to familiarize myself with the program. Sounds exciting.
Yeah.
Thank you.
No problem.
Anyone else on the phone? Announcements, comments? And you'll have to forgive me, I'm not very good with the parliamentary process. So informally shouting out and not necessarily raising your hand is okay with me. Although I think Julia needs us to stick to the rules to some degree. So, but I appreciate you shouting out.
No problem. Thanks again. Like I said, I didn't know how that worked, and I didn't want to be that guy.
Yeah. We appreciate it. Okay, so Julia, did you want to mention, make comment on the upcoming events?
Yeah, we can move on to that. Sorry, did you want me to read them?
Yeah, go ahead. Or yeah, are you familiar with them?
Sure. Yeah, so we have a couple upcoming events. There's a traffic incident management training course, a couple of dates coming soon. That's free, and it's 4 hours. The Southwest Trauma and Acute Care Symposium, which will be virtual, will be October 7th through 8th. And then any other upcoming conferences can be found on our website, as well as CE opportunities.
Thank you. And our next meeting would be November 18th, same time. And I'm hoping, fingers crossed, that eventually we have in-person meetings coming up, but I haven't heard anything yet, Julia. Is there anything on the radar?
I think that so actually, for this meeting today, we did have a meeting space available. It was discreetly posted on the agenda. But nobody came. Okay, I know, but we didn't emphasize it. But yeah, I think by the time our next meeting rolls around, we should be good for in person as people are interested in coming.
Yeah, it'd be nice to be able to talk in person again. I would enjoy that. So, and I encourage everybody, if you want to get items on our agenda, to reach out in advance, and we'll have them on our agenda and be able to, whether it be any announcements or any ideas that you have going forward. the efforts of this committee, I think, is driven primarily by the participation of our group. So I would encourage it and be very appreciative for any ideas that you have going forward that we can tackle and make come to fruition. So thanks, everybody. And without anything else, I think we're at the point of adjournment. Is that correct?
Yeah. Yes. Thank you, everybody, for participation today.
Thank you.
Okay. Thanks, everybody.
Thank
Appreciate all your time.
Thank you, everyone.